Welcome to Facts TV News, where everything is true. Montague loses sister and cousin to COVID just one day apart. Transport and Mining Minister Robert Montague is in mourning following the passing of his sister and cousin just one day apart after each contracted COVID-19. Robert's sister, Caroline Angela Rodney, died on Sunday, August 22nd, and his cousin Darrett Palmer Loban, affectionately known as Auntie Betty, died on Monday, August 23rd, according to a release from the ruling Jamaica Labour Party on Tuesday. The JLP, for which Robert served as chairman, stated that both women ailed for a short period of time after contracting COVID-19. The party expressed condolences to Robert and other Jamaicans who have lost loved ones to the respiratory illness which has claimed more than 1,400 lives in the island. The Jamaica Labour Party assures its chairman and all Jamaicans who've lost friends and relatives to COVID-19 of its support during the difficult time which they are encountering, said the JLP. We ask that you keep Minister Robert Montague and his family and all Jamaicans who have lost loved ones to the virus in your prayers, the release continue, adding the JLP implores Jamaicans to remain confident that though the country is going through difficult times, we will emerge stronger. Jamaica is currently grappling with the third wave of coronavirus infection and on Monday recorded its highest ever 24-hour increase in cases of 879. Downed utility pole causes power outage in Russell Heights. Residents of Russell Heights, St. Andrew, who have been without power since early Tuesday morning, have been advised by the Jamaica Public Service Company JPS that the issue has been caused by a downed utility pole. The power company advised that the problem should be fixed and power restored to the area by 2 p.m. Tuesday afternoon, as there is a team currently working in the area. JPS advises that customers in sections of Russell Heights are without power due to a downed utility pole. Team are working to have power restored by 2 p.m., the power company stated in a text message to customers. Teens happy for job. A desire to return to face-to-face classes, engage in competitive sports, and getting a fighting chance against COVID-19 were among the factors that drove scores of teenagers, accompanied by their parents, to the vaccination center at Montague Regional Hospital yesterday. I'm here today to take the vaccine so that I can go to school, knowing that if I get COVID, I'll be able to recover fast, Belair High School footballer 16-year-old O'Keen Kelly reported. We have been on a lockdown under restrictions for like a long time now, and it's really been hard on everybody and on the football team because we haven't been playing any sport or going to school, he added. The youngster and his colleague expressed relief after receiving the Pfizer vaccine as the government continued a vaccination blitz that started last Saturday for students 12 years and older. Word from the Ministry of Health and Wellness yesterday was that just over 21,000 of the targeted 25,000 students received a first dose of the vaccine over the weekend. Yesterday, Kelly complained that virtual learning has been difficult. Therefore, he is looking forward to being among those who will return for face-to-face classes and to the football field to represent his school. I know for a lot of students, they can say the same about this. The online classes are very hard for most of them. I'm here today to take the vaccine to ensure that I am one of the person that is ensuring that football and classes resume, he said. His classmate, 17-year-old Timothy Hastings, who is also a member of the Belair High School football team, agreed. It feels good to take the vaccine. We are glad to take it so that we can play the Costa Cup, because we have been out of football competition for about 2 years now, and we are glad to get back out on the field, stated Hastings. Another teen, who asked not to be named, said he doesn't want to become a casualty of the novel coronavirus. I decided to take the vaccine about 3 months ago when I asked my mother if I could get the vaccine. First of all, I don't want to die from COVID, and I just want to live longer, said the 14-year-old. 17-year-old Joel Wilmot said, it is the right thing to do to help protect me from the virus. Meanwhile, Councillor Omar Miller, Jamaica Labour Party Craighead Division, who had accompanied his 14-year-old son to the vaccination center, encouraged Jamaicans to get vaccinated against the novel coronavirus. I am here for my eldest son to be vaccinated for school. It is important that we follow the protocols and understand why we are having them vaccinated. I would recommend that people do their research, make their own assessment, and realize that it's important for us as a country to take the vaccine. Without it, moving forward is going to be a very challenging one for the economy and for us as a people, he said. Custos of Manchester, Garfield Green, who had accompanied his twin children, Jade and Sean, to the vaccination center on Sunday, also appealed to Jamaicans to get vaccinated. I would like to encourage others to join the drive to protect ourselves and others. Our efforts in this regard will help us return to normality sooner rather than later, especially with face-to-face classes, noted Green. Jamaica records 752 new COVID cases, 15 more deaths. Jamaica recorded 752 new COVID-19 cases and 15 deaths on Monday, bringing the infection total to 63,464 and virus death toll to 1,417. The Ministry of Health and Wellness reported that the new cases comprised of 450 females and 302 males, with ages ranging from 12 days to 98 years. The cases were recorded in St. Catherine, 126, Kingston and St. Andrew, 113, St. Anne and St. James, 70 each, Westmoreland, 68, St. Thomas, 55, Trelawney, 46, St. Elizabeth, 45, Clarendon, 44, Manchester, 41, Hanover, 39, Portland, 22, and St. Mary, 13. The latest deceased comprised of a 75-year-old female from St. James, a 75-year-old male from Kingston and St. Andrew, an 80-year-old female from St. Catherine, a 68-year-old male from Kingston and St. Andrew, a 63-year-old male from Kingston and St. Andrew, a 58-year-old male from St. James, a 49-year-old male from Manchester, an 89-year-old male from St. Mary, a 76-year-old female from St. Anne, a 67-year-old male from Clarendon, a 56-year-old male from Westmoreland, a 66-year-old female from Kingston and St. Andrew, a 66-year-old male from Kingston and St. Andrew, a 49-year-old male from St. Anne, and a 66-year-old from Clarendon. Jamaica has 13,820 active cases after 56 people recovered from the virus, bringing the total number of recoveries to 47,843. Currently, 589 people are hospitalized, 90 of which are severely ill, while 59 are critically ill and 179 are moderately ill. Brownberg urges rethink of face-to-face classes vaccination requirement. Opposition spokeswoman on education, Angela Brownberg, has called on the government to walk back its decision to have only vaccinated children return to face-to-face classes, arguing that to do so otherwise would be to trample on the right to education. However, her position is being countered by Dr. Carla Golota, Executive Director of Human Rights NGO Stand Up for Jamaica, who said that mandatory vaccination requirement for children to attend school in person is not novel. Health authorities last weekend embarked on the first leg on a drive to vaccinate children 12 to 18 years following the arrival of 200,000 Pfizer vaccines in the island last Tuesday, the first of 3 strands of a total of 600,000 doses. According to the administration, children 12 and older are being prioritized for the jobs for this shipment, with parental consent, the aim being to allow them to return to face-to-face classes in September. Education Minister Favour Williams last week said, while vaccinated students will be eligible for face-to-face classes, those who are unvaccinated will have joined classes online until they receive the jab. Brownberg, however, is urging a rethink. First of all, I want to make 2 points. The first one is, I am fully vaccinated and I encourage everyone to be vaccinated. The second is, education is a right that should be guaranteed to our children, and I am sure our human rights lawyers and our constitutional lawyers are going to be looking at what the Constitution says, she said. I believe the government has a responsibility to provide every opportunity to provide for the education of our children, especially after the last 2 years, where our estimate is that as many as 200,000 have been disengaged and have not picked up a book or done much in the last 2 years. And therefore, I believe that the government should continue to encourage teachers, parents, and students to continue to take the vaccination. But I believe it would be a very strong step to deny a child the opportunity for education because they are not vaccinated, she further argued. However, Carla weighing in on the discussion said, first of all, I would love to remind everybody that all children, whether they go to school, have to have an immunization card, today we accept the fact that every child in Jamaica needs to have an immunization card to access school. Pointing out that she is fully vaccinated, as are many of her family, Carla stated, "I believe the reason there is such a strong push towards asking everybody to take the vaccination is the numbers, which is a lot. If you don't do it for yourself, that is your free choice, but you live in a community, you live in a family where there might be other people who are affected by your choice about sending children to school. It is a right, yes, but also it is a right for parents to return to work. It is not an easy situation." Added Carla, "I don't like the campaign too much, but in a moment like this, I think that taking the vaccine is a way to go back to normal life, to reduce the numbers, to reduce the risk, and to allow our children to be with other children and their teachers, also to learn. That is what education is for." Campaign to vaccine children 12 to 18 years old is a way to send them back to face-to-face classes. We have seen how difficult it is for them to be online. It has been very challenging. As far as mandatory vaccines in Jamaica are concerned, up to 2019, the country's immunization schedule offers vaccine against 12 vaccine-preventable diseases as recommended by the World Health Organization. The majority of these vaccine doses are delivered in the first year of life, along with the measles, mumps, rubella vaccine and booster doses of polio vaccine in the second year of life. Since 2010, the Children's Health Passport is issued at birth and it includes the individual record of vaccination. Since 1986, the Public Health Immunization Regulations of the Public Health Act of Jamaica has specified that all children under the age of 7 must be adequately immunized before entering to school. Only children with a medical contraindication of vaccination, as documented by a public immunization officer or medical practitioner, are exempted. The Public Health Immunization Regulations also stated that it is the duty of every caregiver to have his or her child vaccinated as recommended by the Ministry of Health and Wellness. Additionally, anyone, caregiver, school staff, or healthcare workers violating the Public Health Immunization Regulations is subject to a fine of $500. Defrauding on the fine payment could result to up to 30 days in prison. In 2013, these penalties were increased to a fine of $1 million and imprisonment not exceeding 12 months. Please remember to subscribe, like, share, and click the notification bell for daily updates.